Hi, I'm Cheryl McQuire. I'm an SPHR postdoctoral launching fellow based at the University of Bristol, and today I'm really pleased to be talking to you about my ResNet funded project, which is called Mapping the Landscape of Prenatal Alcohol Prevention in the UK, a collaborative review. So first, a bit of context about why this is an important area to be looking at. So currently the Chief Medical Officer guidance is that the safest approach if you're pregnant or if you're planning to have a baby is not to drink alcohol. But in the UK, rates of drinking in pregnancy are quite high. So a recent review placed the UK's fourth highest in the world in terms of drinking in pregnancy, with an estimated 41% of women drinking some amount of alcohol in pregnancy. So this and other evidence resulted in a call from policymakers for urgent action to reduce the harms of drinking in pregnancy. But evidence of what works for prenatal alcohol prevention in the UK is very limited. So there are some initiatives, but these are limited to quite a small number of local authorities, and many haven't been comprehensively evaluated. So to address this knowledge gap, this project aims to identify, evaluate and synthesise the evidence on initiatives for the prevention of prenatal alcohol exposure in the UK. And to address this aim, I'll be looking at a range of research questions that span content, process evaluation and effectiveness components. So I'll be looking at questions such as what do these interventions look like, how are they received, are they effective, and also any impacts on health inequalities and other unintended outcomes. So one of the really appealing factors of this funding was the focus on building collaborations. So I'm fortunate to, on this project, be able to work with a team that spans various SPHR institutions, as well as other academic institutions, as well as third sector organisations, NHS colleagues, and individuals from Public Health England. So this will give the review a real breadth and a real range of voices from different people. It will also help generate input in terms of different methodological expertise, subject matter expertise, and perhaps opportunities to work with people who are pregnant or who have been affected by alcohol-related harm. So I'll be carrying out a range of different activities to try and gather the evidence that we need for this project. So I'm currently undertaking an evidence search where I'm consulting with collaborators to identify relevant initiatives and further contacts. I'll be carrying out evidence gathering activities, which will include at least one public and one service provider workshop, probably virtually, as well as communicating with people through a range of different mediums, teleconferences, email, face-to-face if possible, but we will see. And then, as well as all the evidence that we gather during these workshops and consultation exercises, I'll also be looking into whether we can scope and obtain data sets to enable new natural experimental evaluations of initiatives that have taken place in the UK. Now, the topic of drinking in pregnancy is a really emotive one that continues to generate a really wide range of opinions. So it's really important to carry out some public involvement and engagement activities to help inform this research. So I'll be looking to speak to people, for example, women who are pregnant and those who aren't, people who've been harmed by prenatal alcohol use, as well as representatives from pregnancy and alcohol charities, to make sure that we are asking the right questions, that we're asking them in the right way, and that this study reaches and includes a breadth of people, so the right people for the workshops, and that also any findings are disseminated to the appropriate groups. So from this work, I hope to generate a range of different outputs, including peer-reviewed publications, blogs, policy briefings, stakeholder reports, that will identify current best practice, why certain initiatives work or don't, highlight important gaps, build collaborations and skills, and also inform my future funding applications. Thanks for your time. I'll provide my contact details for any follow-up, and I look forward to any questions.